During September and October 2011, the United Nations Population Fund, in collaboration with Government of Rwanda, the World Food Programme, the EngenderHealth and Fistula Care Project organized a Fistula campaign. The campaign was held at Mugonero Hospital from 29th of August to 9th of September 2011 and Kibogora Hospital from 10th of October to 21st of October 2011. Obstetric fistula is a childbearing injury that has been relatively neglected, despite the devastating impact it has on the lives of girls and women. It is usually caused by several days of obstructed labour without timely medical intervention, such as a caesarean section.
Like maternal death, fistula is almost entirely preventable. Once common throughout the world, fistula has been virtually eliminated in Europe and North America through improved obstetric care. Fistula tends to affect the most marginalized members of society: young, poor, illiterate women living in remote areas. The root causes of the condition include poverty, malnutrition, poor health systems, and gender discrimination.
The exercise of repairing women was led by Dr. Issa Labou, a urologist from Senegal, and Dr. Biller, UNFPA Fistula Project Coordinator in Ivory Coast, assisted by a team of physicians practicing in Rwanda.
These women are stigmatized and isolated. After treatment, they need support to reintegrate into their families and society. They should be helped to practice family planning for at least 1 year. It is recommended that the next pregnancy should be monitored by doctors and the baby should be delivered by caesarean section.
At Mugonero Hospital, 110 women turned up for screening, out of which 20 women were treated, with a success rate of 80%. I have lived with fistula for 17 years. When I got it, I stopped social interactions. Whenever I tried to socialize, people called me names and avoided me because I was smelling of urine. I thank local leaders who encouraged us to come here for treatment. I encourage all women with fistula to go for treatment. I'm 42 years old and have lived with fistula for 22 years. After having a stillbirth and getting fistula, my husband abandoned me and got another wife. My family also hated me and called me names because I was smelling. When I get cured, I will thank God.
The Fistula campaign in general has been started on 25th August this year, and all levels of the Ministry of Health were involved, from the community health workers up to the high level in the Ministry of Health, and especially the Karongi district with the Mugonero Hospital District Hospital, and with the support of UNFPA, we have been able to screen more than 100 persons, exactly 103 people, and we found that 22 had fistula. When we are talking about fistula, we are talking especially about obstetric fistula. The campaign has been very successful because it was the first experience, and it was prepared in a short period. The population has been sensitized because among those 22 people we received, we have been able to receive even 2 people, one coming from Southern Province, another one from Eastern Province. I want to talk also about the capacity of Mugonero Hospital to treat patients in this campaign and after. As you may know, we have a surgeon, a general surgeon here, who is permanent in this hospital. He also operated some cases, and the consultants, the urologists, which can be brought by the Ministry of Health and UNFPA, confirmed that the surgeon is able to operate successfully fistula cases. And that is very fine, because in the future we'll continue receiving patients, and the hospital has the capacity in terms of human resource and infrastructure and equipment to treat those patients and do the follow-up.
At Kibogora Hospital, 60 women turned up and 28 were treated with a success rate of 75%.
Ubundi ni uburwayi bushobora gukira, ahubwo ikibazo dufite cyane muri kino gihe nuko ubwo burwayi
Fistula can be cured. The biggest problem we face is that women with fistula live in isolation. In most cases, their husbands abandon them. Women with fistula can be operated on and cured, although some cases are more complicated than others. Doctors try their best, and we have many people who get cured. Women with fistula should know that it is possible to go to hospital. They should seek advice from their local health centers. Those who have been treated should avoid sexual intercourse in the first 3 months after treatment and avoid pregnancy for at least 3 years. When a woman gets fistula, she should go to hospital immediately, because it is easier to treat when still new. We urge those women who are still in isolation to come for treatment, because most people who go to hospital get cured. People who have relatives with fistula should advise them to go to hospital.
I call on decision makers and development partners to prioritize assistance to fistula patients. Women with fistula should be helped because they got it while giving life.
Fistula is a very bad disease, but which can be cured. And in the future, our strategy will have 3 axes. The first one is the prevention, because it is the cheapest way of dealing with the problem, and will be helped by community health workers who will teach and continue sensitizing women to come and live at health facilities.
Without treatment, fistula often leads to social, physical, emotional and economic decline.